Welcome to another edition of the DAMY vlog. My name is Dr. David Duizer. Thank you so much for tuning in. If you like integrative health and wellness type videos, this is the channel for you. Please subscribe for more videos like this one. Today on the show, we're talking about a concept called hyperinsulinemia, or really high insulin following a blood sugar spike. You're probably familiar with the term blood sugar. It's a way of describing how your glucose, your sugar in your bloodstream, rises after you consume food, specifically carbohydrates. And with that, your pancreas releases insulin, which pushes sugar into the cells so you can use it as fuel. Now, what happens when you eat too much sugar is your insulin goes really, really high. If your sugar goes up really quickly, your insulin goes up really quickly, and then the sugar comes down really quickly. And that's really the premise for today's episode. We're talking about liquid sugar specifically. And the reason I'm interested in this is because the idea of hyperinsulinemia, or the experience of hyperinsulinemia or high insulin, is that it's really bad for you. And if you're familiar with blood sugar control in general, it's really, really important for reducing the risk of diabetes. So diabetics have a difficult time controlling their blood sugar because their cells don't respond to insulin in the way that they once did. And therefore, the level of sugar in their blood remains high, and it's pretty damaging. But before diabetes takes place, the daily impact of extremely high insulin levels is also bad for you. It causes a few things to occur. It can cause high blood pressure. When your insulin goes up really high for a prolonged period of time, your kidneys hold on to sodium, and that causes your blood pressure to go up. When you have high insulin a lot, your triglycerides go up, and your cholesterol goes up as well, which makes your blood a bit sticky. When your insulin is high, functionally, a few things happen. You have increased sugar cravings. So the up and down motion of your blood sugar, so going really quickly, will cause you to crave more sugar. That up and down motion of blood sugar really quickly will cause you to feel more fatigue, so it decreases energy. And finally, hyperinsulinemia, or high insulin, causes weight gain and especially causes difficulty losing weight. So those are a few key functional things about having high insulin all the time. Now, my experience is that I have been wearing a continuous blood sugar monitor, so I'm able to see exactly what all the food I consume does to my blood sugar, and therefore I can predict my insulin release. And I've noticed a few things. The first story I'll share with you is a story about my coffee creamer. I was using a coffee creamer that was an almond coffee creamer that was just slightly sweetened. I believe it was 1 or 2 grams of sugar per tablespoon. And I noticed on the first day of using this glucose monitor that my blood sugar went up and down really quickly within 30 minutes. It went up by 1 point using Canadian metrics, which for me is a lot considering my breakfast doesn't even really do that. So knowing that, I made a shift and stopped using that coffee creamer, and have not had that kind of swing first thing in the morning since that time. I'm not, it wasn't even a switch, it's just a removal now. I'm drinking black, which is depressing, but oh well. And so just knowing these type of things, I think, is really helpful. So that story is really important to me because liquid sugar seems to cause the most dramatic swing because it's immediately available to be absorbed. So the best example of this is when you drink a can of pop. A typical can of pop has about 35 grams of sugar per can, immediately available to be absorbed. I haven't done it on myself. I can't even imagine how high the blood sugar would go after something like that. The next story I'd like to share with you is a story of me walking around the other day and seeing 2 kids walking with 2 bottles of kombucha. Now, kombucha is a fermented drink. It has some good health benefits, health properties, but it still has sugar, and they're all a little different, but they range from 10 to 12 grams of sugar per bottle. So I'm walking my dog, and I see these 2 little guys, about 10 years old, walking by themselves, each drinking a can of kombucha. And my issue with this is that they probably think they're doing themselves benefit. And I've been in the exact same situation. I drank kombucha every day for about 2 months last year without knowing the extent of how this liquid sugar would affect my blood sugar and subsequently insulin levels. When we think about my change of 1 point increase after 30 minutes from just this 1 tablespoon of coffee creamer, think about what these little guys are getting after drinking 10 grams of liquid sugar within, say, a 15-minute period. Or, as we used to do when I was kids, drink a whole can of pop within 15 minutes, and what that was doing to our blood sugar, and how that was affecting our health overall, our energy, our mood, our cravings, decision-making processes later in the day. And I'm a bit like, okay, we need to make a big shift here. We should not be drinking liquid carbohydrates, period. We should be focusing on water. A quick case study to share with you. I've got some cancer patients wearing these continuous glucose monitors, especially if they have diabetes. And this case study is the only thing that they noticed in their first 2 weeks was their cafe latte that had no sugar. It was only the sugar from the milk, the 2% milk, that was driving their blood sugar up actually 2 points from 6 to 8. And it's discouraging. That's the only thing they had to change, which is great. So now they know that, but it happened within the first hour. So without this monitor, they never would have known. So my point of this video is we have to stop consuming liquid sugars. And the benefits we'll see is improved blood pressure control, improved blood sugar control, reduced cholesterol, better energy, less cravings, and less mood swings, and therefore we'll make better choices throughout the rest of the day, and it'll be much easier to stay healthy moving forward. So look for sneaky places where you might be getting liquid sugar. One example is in milk you put in cereal, for example. Another example is coffee creamer. Another example is these buying beverages at the store. Regardless of what they are, check and see if there's any liquid sugar and accept nothing but zero. That's my video for today. Thank you so much for watching. If you like holistic health and wellness videos, please subscribe and like this video. I'm going to be doing more videos in the future about hyperinsulinemia or high insulin levels because I'm really passionate about it. Thanks for watching and have a great day.